Good morning and good afternoon, everyone. Welcome to the call Migrants in Africa and COVID-19 from Emergency Measures to Inclusive Social Protection System. My name is Camila Coase, and I'm a policy analyst at the Migration Policy Institute. First, a housekeeping note. If you have any technical problem, please email events@migrationpolicy.org or call the number indicated on this slide. We will have a Q&A at the end of the call. There won't be a voice Q&A, but please type any question into the Q&A chat box on the right side of your screen and send to the host, or email question to events@migrationpolicy.org. You can also tweet your question at Migration Policy or hashtag MPI Discuss. Audio from today's webinar will be available later at migrationpolicy.org/events. Today, we welcome three very special guests. Sophie Nonen-Masher, who is the Acting Regional Director for Western Central Africa for the International Organization for Migration, Philippe Bapjusiu, who is Socioeconomist at the African Union, and Andrew Allier, who is a Senior Social Protection Specialist from the Decent Work Team for Eastern and Southern Africa at the International Labour Organization. We're here today to discuss a reply to COVID-19 by African states, aid organizations, and international organizations such as the African Union. To what extent these answers have been inclusive of migrants and the implication for the future of mobility and migration in Africa. In the past few months, most African states have closed their border in an attempt to contain COVID-19, halting cross-border trade and pastoral corridors. This has resulted in the loss of livelihood that has been devastating for many. According to economic forecasts, COVID-19 should result in the first recession in sub-Saharan Africa in 25 years. Across the continent, the situation left tens of thousands stranded and many more in need of emergency assistance for shelter, healthcare, and food. But already under the pressure to deliver health services and emergency safety net for their citizens, host countries often lack the capacity and the resources to support migrants, especially the ones who are in transit or informal workers without legal status. Today, first, we'll discuss the challenges faced by these migrants in border town and urban center, and the emergency assistance that has been deployed with the help of humanitarian and development actors, countries of origin, host countries, civil society, including diaspora. We will then talk about the broader question this crisis raises, and more specifically, social protection system in Africa and how inclusive they are for migrants. In many ways, the crisis has confirmed the need for a more solid and more inclusive system. There have been many progress made in this area in the past 2 decades, including in terms of social safety net programs, but more could be done to build systems that include migrants and to strengthen cooperation between states, especially between countries belonging to the same regional economic community. But first, I will let Sophie Nonen-Masher tell us about the situation in West and Central Africa. What have been the pressing needs experienced by migrants and their host communities, and how IOM and other government and non-government actors have responded. Sophie Nonen-Masher is the Acting Regional Director for Western Central Africa at IOM. She's a specialist in migration policy and has been working for IOM since 2000. In 2009, she was appointed Aide of Regional Counter-Trafficking for Asia-Pacific at IOM Bangkok Regional Office, and in 2011 became Senior Regional Policy and Liaison Officer for Asia and the Pacific, and in 2017 for Western Central Africa. Sophie, the floor is yours.
Thank you, and thank you very much for providing me with an opportunity to give an overview on the situation of migration and COVID in the context of West and Central Africa. I would like to start maybe to remind you of the importance of migration in the region to better understand why it's so important to speak about that topic today. In fact, for West and Central Africa, I think migration and mobility is really crucial. It's part of the identity of the region, but also it's essential for the development of the economy of the region. And currently, with what we can say, its migration provides a livelihood strategy for millions of people. Just as a reminder, it's important to have in mind figures. So there's currently about 95 million West and Central African migrants in the region. But on top of that, you also have to keep in mind that there's 20 million individuals which are relying on pastoralism for their livelihood. And for these people, it's really important to be able to be mobile internally as well as internationally. These categories of people on the move shall not make us forget that there's also 6 million internally displaced persons due to crisis in this region. So with this figure, it's not very difficult to understand the impact that have had the travel restriction and other measures taken by government to prevent the spread of COVID-19 in the region and the mobility landscape of the region. And these restrictions have disproportionately affected migrants as well as IDPs. These measures, as you mentioned on the introduction, had a serious socioeconomic impact for millions of people. And as we speak, there are currently about 30,000 migrants stranded at borders and nearly 2,000 people waiting in transit centers in the region. So what can we say in terms of challenges and needs of migrants? I think first it's important to put also the COVID-19, which is a public health crisis in the context of Western Central Africa, because countries and governments in this region are affected by the COVID-19, but before this situation, they were already addressing a number of serious challenges. The challenges were ranging from food insecurity, as well as insecurity due, for example, to intercommunal tensions and violent extremism. So how does it impact migrants in a very concrete manner? First, what you have to understand is that most of the stranded migrants in the region, they have lost their job or income, and this prevents them to access to a certain number of health or other protection services. What can be said as well is governments in this region, they have followed the WHO guideline, which says that there should be put in place free testing and free treatment in relation to a pandemic like COVID-19. So this is in place. However, the information about this opportunity doesn't necessarily reach out to migrants, which in fact affect them in the way they access the services. And finally, one other thing that is important to have in mind is many migrants in the region are irregular, and they may fear to reach out for help because of the situation, because they fear that if they ask for access to these services, they might be arrested or face detention or deportation. So given this current situation, what can be put in place and what we see as a priority of IOM? So for us, one of the first priorities is really about the inclusion of migrants in national COVID-19 responses. Indeed, priority should be given to the protection of migrants' well-being and to provide them with safe access to basic services, including COVID-19 treatment and prevention services. This is particularly important for migrants in an irregular situation. I think at this stage of the crisis, I think priority should be given to a public health and the importance of public health for the entire population. As long as in this region there will be migrants will have no access to these services, I think what is at stake is a protection from COVID for the entire population. When we speak about migrants and the importance of the inclusion in national COVID-19 response, it's also important to understand that it's not just about access to health and health services. It's also about finding solutions to try to remedy to the impact of some of the response to mobility. So to just give some concrete example for IOM, for instance, in Niger, what we did, because we saw, in fact, an increase of population in transit centers. You have to remember that there's a certain number of routes and itineraries which goes to Libya, North Africa, and you have migrants which have been stranded in this region and wanted to go back home in their countries of origin, but they could not do so because the borders were closed. So for these people, they came to a transit center, which are run by IOM and the government. And what we see is that these transit centers are becoming very crowded, and we put in place social distancing type of measures, and we also strengthen infection prevention and controls in centers. This is just one example. Another example about addressing the situation for migrants is also to allow them to return, but this has to be done in a safe manner. So far what we did is we were able to return 1,700 stranded migrants through assisted voluntary return to their countries of origin, and this since the beginning of the outbreak. We were able to do so because government supported us and opened some humanitarian corridors. However, I think this can be done only if the proper sanitary measures are in place. So for this movement, we made sure that every migrant benefited from prior health assessment, and they were also put in quarantine upon arrival. A second priority is really for us to strengthen disease surveillance at borders so that borders can be reopened as quickly and safely as possible. Why is it important? As I mentioned in the beginning, I think it's because cross-border trade is crucial for the region. It represents about 12% of the region's overall trade value. So reopening borders is the only way to boost the economy and to enable millions of households to rebuild their livelihood and therefore give them the possibility to access services. So as an organization, what do we do to support the government effort in this direction? In fact, IOM, we are helping health authorities across the region, and in particularly in border areas, to assess the health of travelers by providing equipment, training to border agents, as well as through community engagement activities. And maybe the final point and the final priority I would like to flag today, it's really the importance of paying more attention to the vulnerabilities of IDPs in the region. I mentioned that there are about 6.6 million IDPs in the region, and these IDPs are almost exclusively reliant on humanitarian aid, which has also been impacted by restrictions on mobility. So IDPs who have previously been able to earn wages through the informal local labor market to supplement aid received are now unable to do so, given restriction on entry and exit from many IDP camps throughout the region. Additionally, stigmatization of IDPs by host community fearful of the pandemic and concern over resources and service trends has further reduced ability of IDPs to avail themselves of livelihood, services, as well as social protection mechanism locally. So here again, to give you an example of what can do an international organization to try to remediate the situation, IOM in Nigeria, in the north of the country, we, for example, in a camp situation, we try to identify the most vulnerable people. So for instance, we have identified more than 4,000 elderly people in camps and camp-like settings, and to protect them from the risk of infection, we developed and set up individual shelters. We have also installed hand washing stations, and we are currently supporting the construction of 19 quarantine shelters. And we are also rehabilitating buildings to accommodate IDPs of overcrowded campsites. These are just a few concrete examples. A last example I would like to give, because I think it's important when we speak about COVID and we don't necessarily speak about the impact of this pandemic on psychosocial health of the migrants in the IDP. So we are also putting a lot of emphasis through our awareness raising campaign to reach out community and family and to support them, including in terms of psychosocial support. To conclude, what I want to say, it's true that this pandemic is very challenging for all the region of the world, and West and Central Africa is not an exception. But it's also important to maybe think of it as an opportunity. It's an opportunity, in fact, in setting up universal social protection system that will help the most vulnerable access basic goods and services to get through the crisis. It's also an opportunity to build more inclusive society by explicitly including them in national preparedness, response, recovery plans, regardless of the status. Thank you.
Thank you very much, Sophie, for this comprehensive overview of the situation experienced by migrants in the region, a region that depends so much on free movement and mobility. I would now like to turn to Philippe Babjusiu to speak about the response of the African Union and African government to the crisis and how migrants have been integrated in these responses. Philippe Babjusiu works as a socioeconomist at the permanent mission of the African Union to the European Union and ACP group of states since August 2016. He over 13 years experience as a development practitioner and has been instrumental in the implementation of various initiatives within the AU-EU Migration Partnership Framework. Philip, I'll let you speak.
Thank you. Thank you very much, Camille. Dear colleagues, good afternoon, good morning, good evening from wherever you are joining us from. First of all, I hope that you and your families are well in the face of a very complex situation the world is confronted with. It is good to know that for us in Europe, restrictions are easing, although we almost remain vigilant. I believe that the purpose of this event is not to cover every response mechanism across Africa, as we don't have the answers to all the issues. But I will attempt to share hindsight based on common aspects we have been observing, continuous feedback from member states, and relationship with a range of stakeholders throughout Africa. The question is, what is the response of the African Union and how it has encouraged further cooperation between states on the issue of COVID? I would like to state that since the start of the pandemic, the African Union has been highly mobilized to the best of our ability to provide overall direction to member states on the management of COVID-19, including a range of technical services and practical solutions. We have been guided by a high degree of humility due to the many unknowns of this pandemic. For this reason, we have been seized with two main issues. One is strengthening of migration infrastructure for humanitarian mobility and positioning the Africa CDC as the continent's premium response mechanism. On the issue of migration infrastructure, the African Union has ensured that the infrastructure is mobilized and reinforced across the continent. By infrastructure, I mean the technologies, institutions, and actors that facilitate and condition mobility, such as public transportation systems, international air travel, bureaucrats, social systems, etc., to enable stranded migrants to return home. On the position of Africa Center for Disease Control, the African Union immediately kicks the center into action to build and strengthen the capacity of public institutions to detect and respond quickly and effectively to the COVID outbreak. Thus, we have provided the following. One, we have established technical task force in all 55 member states. We have trained over 2,800 healthcare workers specifically for COVID-19. We have distributed over 600,000 test kits to 50 member states. We have successfully deployed frontline responders from the Democratic Republic of Congo to Burkina Faso, Cameroon, Mali, and Niger. We have also established a COVID response fund. The purpose of this fund is to support continental full procurement of logistics to mitigate the pandemic's socio-economic and humanitarian impacts on the continent. We have also established what we call PACT, Partnership to Accelerate COVID-19 Testing. PACT has three components: test, trace, and treat. Testing to diagnose cases, tracing to identify cases and their contacts, and treating to provide treatment and supportive care to cases. We believe that the effort of one set of actors have a greater impact when linked with the work of others. Hence, the issue of partnership is very important to us. Then finally, we have established a solidarity fund and assembled what everybody is referring to as an all-star team to work with external partners and international financial institutions to deliver concrete support to member states. That is what the AU has done. On how African countries have integrated migrants in their national response plans to the pandemic. It is important to note here that the integration of migrants in national response plans is not done in isolation of the broader response mechanism. Therefore, member states are taking a structured emergency, medium and long-term approach that is multi-sectoral and multidimensional, focusing on health and social protection. With respect to emergency measures, member states are facilitating repatriation of migrants from across the world, mostly, as Sophie mentioned, in partnership with IOM, and we are granting them access to a range of social protection measures. Without apparent prioritization, I would like to say that the Ethiopian government has facilitated the return of thousands of migrants and are providing them with diverse flexible instruments that will be critical to livelihood recovery. In Malawi, the government is treating the issue of migrants as an emergency measure under the Ministry of Disaster and are providing support for special visa clearance of all who want to return, including bus transportation from South Africa to Malawi. The government of Sierra Leone has effected on earmarked cash transfers for returnees. In Kenya, the government is setting up migrant relief funds to target returnees. The point I'm trying to make is that all across the continent, returnees are screened and tested upon arrival, and where necessary, immediately taken to quarantine centers and provided with food and other basic necessities. In partnership with IOM and civil society, governments across Africa are providing food, cash programming, mental health and psychosocial support, PPEs to migrants. COVID has also demonstrated the importance of leveraging already established networks of families, civil society, communities, and diaspora to provide social protection to returning migrants. Here is a very important point I would like to state, which is beyond Africa CDC and prior to COVID-19, the African Union had formulated and adopted various instruments and policy frameworks that cater to migrants' protection, namely the Social Policy Framework for Africa, we have the Migration Policy Framework for Africa, we have the Joint Labour Migration Program, we have the Abuja Declaration, and most importantly, we have Agenda 2063. At the same time, AU member states are also signatories to the Global Compact on Migration. We all know that the GCM recognizes shared responsibility as being critical to commitment by states to provide migrants with essential services and to facilitate safe and dignified returns. With respect to the Abuja Declaration, in 2001, AU member states pledged to allocate at least 15% of their annual budget to improve health sector. COVID-19 has registered a sense of urgency to honor that commitment. So, what is the result so far across the continent, and what's our overall assessment? We have observed that, one, there are exciting initiatives in certain countries that could be upscaled across the continent, including effective alignment of political and humanitarian strategies. We've also observed a combination of formal and informal care to enhance social protection and social integration of migrants. Member states are also accelerating the implementation of various AU initiatives aimed at strengthening institutional capacities and structures. And finally, member states are leveraging past experiences, promoting a science-based approach, tapping civil society leaders, and unifying political class. For the segment of this presentation, I would say our conclusion is that there has been proactive reaction by member states to the issue of migrant protection in this pandemic, with a short-term emergency lens, while at the same time observing more structural changes. The African Union is following this from a challenge perspective, but also from the perspective of new opportunities emerging. While we are advocating for immediate actions, we are at the same time advocating for significant and long-term interventions and a paradigm shift in the way we look at social protection for migrants in Africa. I would like to stop here so far and say thank you, hoping to receive comments, to respond to comments and other questions that may arise. Thank you very much.
Thank you, Philip, for this thorough presentation of the new initiatives by the African Union and the answer of African states. And finally, I would like to give the floor to Andrew Alio to conclude with a few thoughts about the long-term implication of the crisis for social protection of migrants in Africa. Andrew Alio is Senior Social Protection Specialist at the International Labour Organization and first joined the ILO in 2009. I'll also remind you that you can send your question in the Q&A box on the right side of your screen. Andrew, I'll leave it to you.
Thank you very much, Camille. Good morning, afternoon, evening, everybody. And thank you very much for the invitation. And based on the notes, the speaker's note, I was expected to put things in perspective and also talk about what is being done in within the framework of the Joint Labour Migration Project. In particular, a pillar 2 that talks about promoting decent work for regional integration, inclusive development, and specifically two 2.2 of Pillar 2 that talks about extending social security to migrant workers through portability regimes. Just as a reminder, the GLMP is was adopted by African heads of states and governments in 2018 as a comprehensive program for labor migration governance in Africa. It's implemented Ireland and the US. I talk about the ILO social protection COVID response monitor web as of June, about 48 in 90% of countries in Africa have announced measures, social protection measures in response of COVID. That gives us a sum. And interestingly, about 70% of those measures are actually related to new programs. Sorry,
Hi, I think we may try and.
Sorry,
I think we may try and.
Camille, do you lose me?
Yes, we're losing you a bit. I'm going to try and reconnect with you on a separate point. Camille, maybe you can go to some of the questions in the meantime.
Sure, I will do that. Yes, apologies for this, for the lack of connectivity. So we have a number of questions already on the topic of the tension between migrants and communities and the benefit these groups can gain access to either as a result of government packages or the assistance provided by aid organizations. I was wondering, Sophie, if you could maybe say a few words of what you've witnessed in West Africa in terms of this tension and how IOM has tried to mitigate this tension between these different groups.
Thank you. I think it's important to keep also in mind that some of this tension were already before COVID-19 and were just exacerbated by the crisis. So concretely, what we do, I think it's really important first to have a good understanding of the disease, its way of dissemination. So we are really focusing on giving a global understanding of the host communities and the migrant and the IDP on what is exactly COVID-19 and also what is their capacity to access services in this context. We are also doing focus group discussion, especially in border areas, to try to mitigate this tension and to try to understand that we are all, being host community and migrants, we are facing the same challenges or similar challenges in the context of this pandemic.
Thank you very much. We also have a few questions about the impact of the economic crisis on social protection system in Africa in general, and more specifically for migrants and what it means for all these societies. Philippe, maybe could you tell us what your witnesses from the African Union side?
Yes, Camille. I think one thing we probably need to understand is that at the moment, there are a lot of good examples. Member states are trying to live up to expectations, to step up to the plate. But this is creating increasing demand and is putting strain on existing facilities. We have to understand that COVID-19 reached us in the context of many vulnerabilities. You know, before it came, we already had low cost in East Africa. We had a series of hurricanes in Southern Africa. We had climate change impacts, which already had impacted health and socioeconomic sectors. So it's no surprise here that the issue has been very challenging. At the same time, for us, like I said, we are looking ahead. Our message is that the member states' response and recovery strategies are going to be combined with transformative approaches. So basically, what we are trying to say is that yes, we have challenges there. We have economic challenges, we have health challenges, we have very socio-economic challenges. But we want to use this opportunity, and like I said earlier in my presentation, member states are now trying to see how they could rally around policy instruments, frameworks, that have been accepted, that have been adopted by them. We're talking about social protection framework, ILO, IOM are coming within the space to make sure that they help member states. The African Union is also there, positioning itself as the continental premium organization to build and enhance the capacity of member states in addressing these challenges. Yes, there are challenges, but we are trying to make sure that the provision to migrants are non-excludable. By non-excludable, we mean that the returnees, the migrants, have access to a range of facilities regardless of their ability. And like I mentioned earlier, we are seeing this across a range of member states. We only hope that we could build on them going forward. Thank you.
Thank you. I have another question for Sophie about the response by ECOWAS to the situation. A few people have asked how ECOWAS had reacted to the situation and whether there had been a discussion on reopening border and how IOM and other actors had supported this effort.
Thank you. In fact, for ECOWAS, as you know, they have this free movement protocol which allows the mobility across the region. However, ECOWAS is also run by the principle of national sovereignty. So what they did, I think they really let the member states decide what is the best measures given the particular context in the region. And in fact, I think currently it's what we are doing with ECOWAS. We are working with them to try to understand what kind of measures, what kind of standard operating procedures could be put in place, especially at the point of entry in the region, to allow movement and mobility to happen again, and this in a safe manner. So what does it mean? That means, for example, to put in place a tracking mechanism to try to track movement of people so if there's a positive case, we can access the community which is affected, the contact person, and do testing, but also provide that they can have access to the treatment. So this is one thing. And here again, it's about the information also of border agents about the importance of these measures, these preventive measures, to make sure that cross-border movements are safe. We are currently working on it, and I think they are really mindful of the importance of this mobility, and I think they are currently working on a phased approach for the reopening of borders. But I think all will depend of national assessment of the current situation. For Western Central Africa, what you have to have in mind, it's currently we are not at the peak of the pandemic. We see the number increasing. We have about more than 70,000 positive cases in the region. So I think it will be about a timely response when the time will be right. So I think this is exactly what we are doing and are discussing with ECOWAS at the moment. Thank you.
Thank you very much. I have another question from a participant on these immigration procedures that were set up. You mentioned expedited visa clearance for Malawi. Philip, do you know whether these is the first or whether these mechanisms were tested before and whether they will be temporary, and what is the timeline for these measures?
My understanding is, of course, for Southern Africa, probably across the whole of Africa, this will have been the first. But I know that since these issues came, since the government of Malawi decided to undertake these initiatives, people have been returning. Because I recall that like 2 or 3 days ago, there was a plane load of forced returnees from South Africa. And government officials were at the airport to receive them, screen and test them, and take them to quarantine centers for those that have to be taken to quarantine centers. But the point I would like to make here is that, of course, it's good that Sophie had already highlighted that. Whilst ECOWAS is, as a secretariat, is working on ensuring that mobility becomes mobility is again facilitated across the region. I think we also have to recognize the fact that certain recs have been trying to see how this was possible, because within East Africa as well as West Africa, I know of cases wherein member states are transporting goods through a process called relay. You know, the trucks will come, they stop at the border, then the other drivers will come in and take it. So if you are coming from one country, let's say you are coming from Guinea, you leave the truck at the border, you don't have to enter Sierra Leone. Then the driver from Sierra Leone will take the truck and deliver it to wherever it has to be delivered. So these are processes, mechanisms that member states had put in place to make sure that they go around, you know, they go around the system instead of prohibiting mobility. But people have been moving across the continent, and I think also the example from Malawi is very good, because one thing we have come to realize is that yes, in as much as we consider COVID as a foreign disease, wherein it's migrants that are bringing it, but communities have also been open to receiving their people. I think this is something that we should applaud, and the example from Malawi is quite laudable. Thank you.
Hi, Philip. Would you mind maybe repeating the last part of your answer? I'm afraid you were cutting.
I was saying the example from Malawi is quite laudable, because even though, yes, we understand that COVID is a foreign disease to Africa, because it was imported to Africa by people who were not staying within the continent, yes, communities have been open to receiving their loved ones, because I've seen it across the whole of Africa, from Malawi to Ethiopia to Sierra Leone to Ghana to Nigeria. Communities are open to welcoming their loved ones. So the initiative by Malawi to facilitate visa for people that want to come back is a very laudable venture, and it's not only happening in Malawi, it has happened in Ethiopia. I know it has happened in Sierra Leone and other places. So yes, I think these are initiatives that should be applauded and probably lauded and emulated across other places where we are facing challenges.
Thank you very much. I now have a few questions about cash transfer programs that have been expanded as a result of COVID. I don't know if maybe Sophie, you want to start, and maybe Philip, you have a take on that. Because there's been a number of cash transfer programs that have been expanded or set up to reply to the crisis, and some of them sometimes benefited to migrants. I don't know, Sophie, if this is some mechanism that IOM has supported, and if you have example of such mechanism.
Thank you. And in fact, I have concrete example. I think one of the most important flows that IOM supported was the return of migrants from like Niger, Libya, and Mali to their countries of origin. I think since 2017, we returned voluntarily more than 80,000 migrants. And we did so in a manner to also support them in terms of reintegration. So we had envisaged a different manner to support their reintegration, especially through training, support to small businesses, etc. However, given the restriction in mobility, we saw that it was very difficult for migrants and for us to put in place this traditional reintegration program. So what we did is, in fact, in certain countries, for instance, like in Ivory Coast or Senegal, we provided a family basket and a cash grant to some of these returnees because they are very vulnerable. They just returned from a very difficult situation, and they have very limited resources for securing a livelihood. So we thought that it was the most appropriate way to address their very, their everyday need in this current situation. Thank you.
Thank you. Philip, do you have anything to add on this matter?
Yeah, I would like to say that in addition to what the partners are doing, I know of a concrete example wherein the government of Sierra Leone, from its national budget, has been catering for returning migrants. And as recent as last week, they actually did some cash transfer on their cash transfer to returnees, about 80 or 100 returnees who had come from Kuwait. So I think this is something I know of, and I'm sure it has been happening across other countries on the continent.
Thank you. I have another question about the role that trade unions and consulate have played in supporting migrants, especially the ones who've lost their job, and to discuss about the responsibilities that employers have towards their former employee. Sophie, is that maybe something you want to comment on first, and then I'll move to Philippe?
Thank you. So the role of trade unions, and I'm sorry, I think your voice were a little bit blurred. So it was the role of trade unions and
consulates. If trade unions in in us countries and consulate of the different countries of origin have been involved in supporting migrants, and also maybe negotiating with employers with former employers.
In fact, at IOM, I think we've been working extensively with consular services, especially for them to provide the necessary documents to allow for travel. And in particular, when in situations where humanitarian corridors were opened to basically allow movement back to the countries of origin. We also been working with civil society to try for association to also reach out more to migrants and to include migrants in vulnerable situations in the solution and the support services that they were provided to the more vulnerable communities in countries. I have no particular example for trade unions, but I'm sure that my colleague from ILO will be able to address that. Thank you.
Thanks. I don't know, Philip, if you have something to add. We're actually trying to get Andrew back on the line. He's calling from Addis, and the connection has not been great.
Yeah, what I would like to add to that is first to support the point that Sophie made, that the consulates have been facilitating the return of migrants. But we also, in terms of negotiating with former employees, I think one thing we have to understand is that particularly migrants from Africa, people, they've not gone, it's not like most of them that are in Europe or in the US, wherein you have governments coming in to follow workers. That is not the case. That is not the case in the Middle East or probably all of Africa. And it's also the situation that most of the people that the migrants have been working for, say domestic migrants, labor migrants have been working for, have also lost their jobs. And these are people in regular positions who did not get any benefit, they've been laid off, So it will be very difficult for the consulates, to negotiate with former employers. But one thing I know with respect to trade unions, I know that, for instance, again, let me come to the example of Sierra Leone. I know that within the context of what we are discussing, but this is basically the issue of not external returnees, but internal returnees, migrants who moved from one region to the other, who have established businesses like small and medium-term enterprises that have gone out of business. I know that quite recently, the government of Sierra Leone has taken a decision to provide support to these people. So whether it falls within the scope of what we are discussing is something else, But I know that some governments are making efforts to cushion the effect of COVID-19 on small and medium-term enterprises. And we also have to understand that some of these small and medium enterprises are also owned and established by migrants. They might not be external migrants, but they might be internal migrants who are moved from one region of the country to another to establish or to work in certain businesses.
Thank you very much, Philip. I think we have Andrew back on the line, so we'll give it another try, provided the connection with Addis is a bit better this time.
Thank you very much, and apologies for the internet challenges. Yeah, just because we have run out of time, just to go quickly through. I was saying that the response generally on the continent in terms of social protection has been, by many levels, impressive. about 48 countries on the continent, which is about 90%, had announced measures as at 9, the latest update we have on the ILO COVID monitor, and about these countries have in total announced about 170 measures, of which 70% are related to the setting up of new programs or new benefits. Yes, if I could give further statistics, about 84% of the COVID response measures relate to non-contributory social protection that falls within cash transfers, and only 6% are actually contributory in terms of. This brings a number of issues into perspective. One, in terms of our approach generally towards the coverage of social protection for migrant workers, and so since 2017 through the ICMPD, we have been implementing a framework for social protection for migrant workers in the region. But part of the issues, drawing back on my introductory comments, is that the focus of the approach of the sub-regional frameworks where we have been supporting for the EAC, ECOWAS, and SADC actually largely focuses on long-term benefits in the formal sector, mostly pensions and long-term benefits related to disability and survivor benefits. Yeah, the argument in favor of this was basically most social protection schemes in the region are already covering this long-term benefit. So the approach for social protection for migrant workers has been through pursuing frameworks or sub-regional instruments that through multilateral and bilateral agreements. And there was a lot of reluctance in terms of the inclusion of short-term benefits, sickness benefits, health benefits, maternity protection, unemployment insurance, and other forms of safety nets. But what COVID-19 has reminded us is the importance of short-term benefits, unemployment benefits, health benefits, sickness benefits. And these were missing in the frameworks that we have been promoting for migrant workers. There was also the question or the debate of eligibility of migrants to tax-funded programs, even though a lot of studies have shown that migrant workers pay taxes and contribute significantly to economic development of these countries. So building back better, in terms of how we move from COVID, is how do we how do we actively, if we are promoting or supporting governments to establish frameworks for migrant workers, or regional or sub-regional framework for migrant workers, I think building back better, it's very important that the short-term measures are included. That also brings me to the point of informality. About 85% of workers in the region work in the informal sector. What the COVID response social protection measures have taught us also is that the majority of the measures are actually measures targeting vulnerabilities or suggesting vulnerabilities or gaps in the existing programs. 84% of all measures on the continent are towards a non-contributory arrangements. And the majority of migrant workers, as we all know, work in sectors that are hardest hit by the COVID pandemic and the lockdown measures. Especially workers in the hospitality and service sectors. And of course, migrant workers are also heavily represented in the domestic workers sector. This shows a major gap in the business as usual response, and we've also seen that in some countries, even when there are measures in place to attract the informal sector, there has been tremendous difficulties in locating them and reaching out to them because of a lack of documentation of workers also in the region. We've also noticed that most of the responses, for example, in South Africa, in Mauritius, and many countries in the region have benefited migrants in the formal sector, highlighting the gaps in the coverage of the migrants. Then, in the interest of time, I'll just wrap up with an important aspect also of financing and the affordability of the current frameworks of social protection for migrant workers. Most the regional economic communities and countries, in terms of social protection for migrant workers, the question has always been, how can we talk about social protection for migrants when we are not able to provide social protection for our citizens? So the issue, meaning that the issue of affordability and the financing of social protection for migrant workers has been quite to wrap up. Many measures that have indicated that 48 countries in Africa, which account for 1% of the people in Africa, have put in place that these are mostly temporary measures. So the important point going forward in terms of building system is, how do we support member states and governments and institutions in the region to build on or transform these temporary COVID relief measures into comprehensive social protection measures for all, including migrant workers. And that's important. And I'm talking about now, and probably there will be questions on how we do that going forward, and making sure that migrant workers are effective.
Thank you, Andrew, for this broader perspective on social protection for migrants. And I think this last question is particularly important. How do we have this inclusive system for migrants, but also nationals when they're constrained on public resources? I think maybe we have only a few minutes left, so that's a question I will direct to Sophie or Philip, and which is a question that Andrew raised. Has many countries like the capacity and the resources? What could we expect from the AU, the EU, or the international community to help to fill this gap, to build this social protection system? This is quite broad, but maybe we can use it as a conclusion for today's session.
Thank you. And I think it's important that to raise it, especially in this region. The government received a lot of support from international communities and donors. However, the needs are so huge that the gaps, I think the funding demand for basically strengthening all these social protection mechanisms is not filled. I think there would be a need for far more resources, but also expertise to support governments in this endeavor. I think one of the strategies which has been put in place, especially in countries which have the less resources, was really to focus as well on a primary health care. And I think that's not an panacea, but that's already a good start. I think to really give priority in particular to primary health care and to have it accessible not only to the host community, but as well as migrants. But it's true that this region would need far more support if we want to be credible in having a better social protection system. And there's another important thing to consider. In a lot of this country, I think social protection is available in capital and big cities. There's a need to really have more outreach, especially in remote area. And this is also important in terms of a lack of services, which are also fueling community tension and instability. So it's important for health consideration, but it's also important in terms of security consideration. So I think we can only say that this COVID-19 crisis, it really highlighted the importance of inclusion in any health responses. And I think it's really important that migrants are included. And if migrants are not included in the health response for COVID, I think this response will not really work. And beyond that, the last word I would like to say, it's true that COVID-19 is very important currently in this region. But what we see also as well, it's a resurgence of other diseases like cholera, measles, Ebola in certain areas. And I think it's also important when you think about a public health response to integrate the COVID-19 response to other health response to other communicable diseases. Thank you.
Very much. Maybe Philip, if you want to add something, and then Andrew, I'll let you have a final word, and we'll close the session for today.
Yeah. Thank you again, Camille. I would just like to say that I'm responding to Andrew's question. First, we have to recognize that if you want to take on responsibility, you need capacity. There's a recognition that member states are stepping up. And as Andrew indicated, now we have like 48 countries that are trying to impress on their social protection record. I think that is something we need to build on. But also, when we tie that to what Sophie said, I think this is where the issue of partnership comes in. For now, we have ILO supporting, IOM supporting. We also want to call on other partners because we cannot do it alone. And like I initially stated, this COVID has hit us at a time when most of the countries are in a very vulnerable situation. So issue of partnership is very key. But I think if there's anything I could take, if there's any consolation I should take, is the fact that the prior commitment that African countries had undertaken, they're signatories to key policy frameworks like the social protection framework, the migration policy framework, the adoption of the GLNP, the Abuja Declaration of 2001, which they are now trying to step up to. I think these are very encouraging signs. And if we all come together, I'm sure we should be able to build on this. And like Andrew said, we can build back better. We can build back better for a sustainable Africa. Thank you.
Thank you very much, Andrew. I'll let you conclude with a few words, and then I'll say a few final words as well.
Thank you very much. Generally, for social protection for migrant workers in Africa, I think the major intervention has been through the EU ICMPD support that is being that is supporting the that is implemented by the ILO and supporting the GLMP. Yeah, of course, the COVID response has highlighted a few gaps generally towards the approach to social protection for migrant workers. This includes, as I mentioned quickly, the focus on formality in the midst of a huge informal arrangement. There are still issues of nationality and residence that we have seen during the COVID response that are hampering effectively reaching out to migrant workers. But importantly, I think it's very important that we look at the mix of policies. Since the majority of the migrant workers are in the informal sector, I think we need to think of innovative approaches through which we can reach migrant workers in the informal economy. This could be through a combination of contributory and non-contributory arrangements, but also there are aspects that have been hampering on the strides at reaching out to migrant workers. Issues of documentation, issues of access to information, for example, and the complexities around affiliating with social protection arrangements. I think collectively, if we have to reach out to migrants, I think this is an important point. Then, of course, in our many consultations with government, social partners, and the RECs, I think there is a strong aspect of political will. Because the migration governance framework, which anchors the current approach to social protection for migrant workers, requires a lot of policy, legal, and institutional reforms to provide access. But finally, I think it is important, as I indicated, how do we move from this whole range of temporary measures and transform them into sustainable social protection measures going forward. I think this requires also engagements on expanding fiscal space for social protection. From the ILO point, because if I could respond to Philip's point that the AU needs help. The ILO has been on the table with the AUC on all the discussions. The ILO is also leading the implementation of the social protection framework for the AU or migrant workers, and the ILO has developed so many tools and capabilities to support member states, and we are helping currently member states in in Eswatini, Lesotho, South Africa, and all over the continent. Yeah, in terms of not only the COVID response, but more importantly, working on recovery plans for sustainable social protection going forward. Thank you very much.
Thank you, Andrew, for this final point, and thank you again to our three panelists today and to all the participants. Apologies for the technical issue with the connection with Ethiopia. A slide and audio from today's webinar will be available a bit later at migrationpolicy.org/event. And please continue to visit our website for updated research and analysis. Thank you all.